Well, thank you to Ebba and Donnie and all the speakers for those interesting insights and talks now on the main stage. We're now here in what I call the Speaker's Corner, where I will interview some of the keynote speakers. And with me I have Mathias Ekman. Welcome. You're a developing marketing manager at Microsoft, and you spoke a lot about big data. Could you just tell me, what are the opportunities versus the challenges when it comes to big data today?
Yes, we see clearly two trends where hospital can start to move into the connected world and apply big data analytics on top of data from the machines today. Often these machines are only used within the operation, for example, but today by putting this data out and make some kind of analytics, you will become better to plan or even to see what is going wrong or what is really, really well done within the operations. And the second thing is the patient data, of course, to do population management for all these non-communicable diseases that arise from the urbanization. That we really, really see as a big trend.
But gathering all this big data is a challenge, of course. What are sort of the key challenges?
Yeah, I think first of all gathering and storing the data, but then of course integrity. Integrity is super vital in this space, and I think that the vendors that is moving into this space really, really need to look into this different aspect, because this is maybe one of the most sensible information that we have, more sensible than the bank account, for example.
And I know there are many areas of implementing big data, but how long is the lead time for this? When do we start implementing and it actually reaches the consumer or the patients?
Yeah, there I think we have seen a big trend, because historically it has been a lot of the technical aspects of setting up these things. What we see as, for example, from Microsoft side, we are applying and delivering all of this as a service on cloud platforms. So I should say that from boarding data to doing real true cloud analytics, now we're talking about days and weeks instead of years.
Well, we're short of time, but thank you so much for that insight and the best of luck.
Thanks.
Thank you. Okay, so I think we have our two talented moderators here sharing one mic. Does that work? Yeah, that works? Okay, so ladies first. Okay, so you've both had interesting talks today. Can you just, what kind of insights have you personally got from today?
I think, the whole outline of the healthcare system is changing more towards the patient perspective. The patient will own more of the information, will also draw a lot of conclusions, and I think that this will actually change the relationship between doctors and patients, and it will be more of a collaborative environment instead of, patient-doctor, doctors know everything, patients don't know anything.
Educating the patients.
Yeah, I agree, and I think the two of the things that I've noted today is that, one, it's happening. Whether we want it or not, it is happening. So it's about getting it, getting on the bandwagon and getting there. Because as like Henrik said in the end here, people are today, they're using apps to keep track of their health, and the apps are getting smarter and smarter, and they'd rather use the apps than whatever might else be out there. So it's happening. That's one thing that I feel. And another thing that I find really interesting, though, is that even though we are talking about hard tools, digital, there actually seems to be a very patient-centered focus as well, where they, as we said as well, don't forget the care and healthcare. There actually is a very human aspect of it. It's not just hard digital value tools. It's actually they are there to help people be helped in a more humane way.
Have any of you tried any apps within health? Are you your own sort of consumers of that?
Yeah,
Are you Runkeeper?
Yeah. Those kind of apps. When it comes to keeping track of training programs and fitness, and also reaching out to get new inspiration for what do I want to do today. That was my motivation for starting with an app. Training was that I need some new ideas, and I need the collaborative force of the community to help me come up with new ideas.
Collaborative force, that's really interesting.
I think one of the things that is very obvious in these sessions is that more responsibility towards yourself. You can't blame anyone for not, taking care of yourself. If you have the information, let's take care of yourself. And I think that the way that the cost of healthcare for people is increasing all the time, we will have less and less provided for free unless you chip in your part. And I think that, in a way, is actually a very good thing.
Those things happen when it's live, right? Okay.
So this one was as well?
Okay. Oh, that's a good thing.
Has anybody heard anything we've said so far?
Well, okay, but a short recap then, and because this is what happens when it goes live. You would say that the insight is that educating the consumer needs to take more responsibility for their own health.
Yeah. Well, the interesting thing there is that it's one thing to say, okay, here is the here
are the tools.
Here are the tools. Here you have the right to your own data. But by saying that, we're also saying you have a responsibility for your own data, and that's something that is a really interesting shift. Because you were talking about that, where it's the healthcare, instead of the doctor being the one saying, you come back next Wednesday, take these 3 pills, and then you as a sort of a more or less a victim or whatever you'd call it, do as he or she says. Suddenly, you are. I mean, the empowerment has 2 sides. It's not only about being able to do it, it's actually having to do it as well. I mean, we were talking about that. Why don't people take their medications? Well, because they don't care, they forget, or they don't want to. Sometimes maybe they need to be told you have to. So no, there's a balance there as well.
And there's also such a flow of information. Like our first key speaker spoke about that, actually going through all the information and finding the vital information. It's time consuming.
And of course, that is one of the problems too, that if you look at all the if you look at a doctor's dictionary, you'd probably have every single disease that you can have, because it's very easy. I mean, if you look at it, maybe I have a little slight headache, stomach ache, backache,
the symptoms.
So the problem is to validate all this information. But I think that the patients actually have a very good I'm tired now. I'm losing
good possibilities now to actually.
Yes, and I think that the more research we do, the more we learn, and eventually we will get very close to what is actually the underlying problem that has a certain set of symptoms.
And something that also was mentioned during the conference a couple of times was actually the importance of peer pressure, because it's not only the information I can find, but it's also not only not peer pressure might be the wrong expression here, but it's also that just by discovering that other people actually have the same affliction or are experiencing. I mean, many people who have like anxiety, they have anxiety because they have anxiety,
exactly.
and they get depressed because they're depressed. But by being able to speak to other people who feel the same way, they go, hey, I'm not alone in the world.
Exactly.
And that empowerment in itself, in my opinion, is more important than the actual information about the disease, not affliction. That knowing that there are other people out there, like Dave, I mean, perfect example when he told us about, when he found the information, how it empowered him to not only understand, but also get the energy to actually move forward and say, well, hey, I don't trust you. I trust these guys.
Yeah.
And getting the support from the community. And that's the same as when you join a community for whatever change you want to be a part of, like training or AA or whatever it is. You need the people to support you.
Absolutely. Well, I would love to speak more, but time is running and you're soon going up on stage. But thank you both for really leading such interesting talks.
Thank you.
You're welcome. Thank you. Do we have anyone more? Dave? Okay, I think coming up here we have keynote speaker Dave deBronkart. Welcome, Dave.
Hi.
How are you? Of course. Do you need any help?
Yeah, I'm blind. I can't see.
Well, it's not that easy either because it's dark. Oh. That was a compliment. Thank you. I'll give you this, a little mic, because we're here at a live webcast. And a few questions. I mean, you gave such an engaging talk about your cancer survival, and also, you know, that you stress the importance of patients educating themselves, and also, you know, getting access to their data. Could you just briefly elaborate a bit more on that, the importance?
Well, the important thing for everybody to realize is that the world has changed in important ways in the last 20, 30 years because of the internet, right? And it's not an insult to doctors. It's not that you don't trust them. I have some of the best doctors in the world for my disease, and they welcome me being actively involved, you know? I talk about empowered and engaged patients. What that means is, see, a disempowered, disengaged patient is somebody who treats medicine like they're a car in a car wash. You know, you roll up the windows and you get things done to you. But these days, there's lots of value in learning what you can. The internet makes that possible. And thinking for yourself and being a good partner with your doctors.
And do you think, I mean, I'm thinking there must be a lot of patients out there who are also looking and who might, you know, have chronic diseases, and there is such a vast flow of data out there, and you were talking a lot about relevant data. What would you recommend them? How do they sort of source the internet, or, you know?
Well, what we need to do is grow more capability in the community. You know, in my case, I joined an excellent community of people with my disease. I was new to the disease. Some of them had been living with it for 10 years. They really knew what was going on. The ideal thing is if your doctor will welcome you wanting to learn things. So, for instance, when I find some new information, I will not just go off on my own, but I'll bring it to my expert, my doctor, and say, hey, I found this. What do you think? And it's interesting because sometimes he'll say, yes, that's good. Sometimes he'll say, no, stay away from that. But about half the time, it's something he's never seen, and he'll show me how he looks at it. Okay. Oh, look at this. That looks good. Or no, stay away from that. It really is a partnership.
And finding the right doctor who's assertive as well. And you also said that when assets digitalize, things move faster.
Yes.
Meaning?
Well, certainly. When any industry becomes computerized, things change much faster. In my case, 30 years ago, I worked in the typesetting industry in graphic arts, and typesetting machines became desktop publishing. Exactly. And all of a sudden, things changed at the speed of computers. The quality got better, the price came down. Today we all have fonts in our phones. You know, most of us do, or at least in our computers. So what we can expect is that things will change much more rapidly in the next 5 years than they have in the past 20.
But I think it's also the difficulty is usually you have an idea, you implement it, you have all access to all of these tools, but then it takes time to actually reach the consumer and for them to utilize it.
Certainly. But that's why it's smart for people who want to start getting involved and learning about it now.
Exactly.
Some people will hear me, I get excited and enthusiastic about it, and they think I'm saying you have to do this, or you're a bad person, or you're a bad patient. I'm not. If somebody doesn't want to have anything to do with it, that's fine with me.
You're encouraging them.
Well, sure. Yes, it is. It's legitimate. It's a sensible thing to do. And it is no insult to doctors.
No. And I know that we have a short span of time, but I just wanted to know, what do you the 3 top things you see happening in the future when it comes to digital health out of your perspective, or hopes, or that you think will happen?
Oh, that's
you know,
which top 3 out of the...
I know.
Well, so one important thing is that as the data, as my information that I create and information from my doctor's offices becomes available for me to manage, new software tools, software companies will start up who want to make tools that are useful for me. Most of them will fail, like any other new industry. You know, Napster, was the one with digital music, and they're gone. And but things will start to change, evolve, and improve very rapidly. It's also predictable that some of the first systems will be hard to use, but then somebody will come along who makes it easy. Right? And the really exciting thing with New Potential for me is that one of my slogans in my book is that everyone performs better if they're informed better, and we will start to see things happen where, for instance, a family member, like in my family, I have 2 sisters who like to manage the family's health. They will notice something that saves a life, you know, and it doesn't replace the doctors, it helps. That's
Absolutely.
why I call it Let Patients Help.
Let patients help, and I think that's a really important message to portray across. And I also, can we summarize by saying that the future is bright, in a sense?
Oh, certainly. There's
Good.
a lot of work to do,
There's a
but
lot
it's
of work to
bright. New things are possible that
Yeah.
never were before.
The evolution of innovation.
Yes. Okay.
Thank you very much.
Good.
The best of luck.
Thank you.
Thank you. Well, that's all from this live cast now, but we'll be back. I'll be back at 5 for a summary of today, and keep watching us.